Early in the pandemic, one bit of encouraging news was that children weren't as vulnerable to COVID-19 as adults. But doctors who treat children with cancer had special concerns. These kids have impaired white blood cells, the ones that fight infection. That can be a result of the cancer itself or of cancer treatments like chemotherapy. So when it comes to common respiratory infections like the flu, children with cancer tend to show more severe symptoms. Would COVID also be more severe in this population? To answer that question, doctors at St. Jude Children's Research Hospital collected reports of COVID cases among 1,500 cancer patients up to age 18, drawing from institutions in 45 countries. The data has been entered into a Global Registry of COVID-19 in childhood cancer created along with the International Society of Paediatric Oncology. The study's findings are reported Thursday in the Lancet Oncology, Global Characteristics and Outcomes of SARS-CoV-2 Infection in Children and Adolescents with Cancer Drive. Sheena Mukkada, an infectious disease specialist at St. Jude and one of the main authors of the study, spoke to NPR about how pediatric cancer patients have fared over the course of the pandemic. Her comments have been edited for length and clarity. What did you think you would find when you began this study? We were concerned because children with cancer do worse with respiratory viruses. So we always had fear that they were not going to do well. Were your fears correct? Of the kids with cancer, 20% had a severe critical infection with COVID. And death occurred in about 4% of all patients, considerably greater than the general pediatric population with COVID. How do those rates of severe infection and death compare to the rates in the general population of kids? We did not do a direct comparison to kids in the general pediatric population. But coming from the literature, severe disease, in that population, is between 1 and 6%. Death is even less than 1% in a lot of these studies. Of the children whose deaths were reported in your study, what was the cause of death? We specifically teased out the group that was due to COVID, that was 4%. The overall death rate, among the 1,500 children in the database, was more like 6% total. And those additional deaths were due to? I'd be speculating. Some of it is related to cancer, some to delays in care, all kinds of factors. Were the rates of severe disease and death among kids with cancer consistent around the world? The outcomes of severe and worse coronavirus disease were more pronounced in low and middle income settings. It's a further illustration of a fact we already know, how interruptions in health service delivery and access to treatment in those countries affect outcomes. It's always sad to see that. It underscores why we have to equitable access to everything, coronavirus vaccines, supportive care. And that lack of access to care isn't just a pandemic problem.